Okay, so the question was, why does Dr. Joshi not like nasal ketamine being used daily?
So, you know, you heard a presentation about central sensitization. You heard a presentation about some of the amazing mechanisms of action of ketamine, but you also heard me very specifically say that this is absolutely not advocacy for daily ketamine use. And the reason is very simple. The goal of what we're trying to do is reset the central nervous system so it's not so hyperalgesic, so it's not stuck in that wind-up phenomenon. But once you reset, you want to get out. You don't need that drug floating around. And to properly reset those receptors, you have to hit a very specific plasma level that's individualized. Every patient's going to be a little different. You give a little too much, you have side effects, a little too little, it's not effective. And the side effects, if you have too many side effects, we've seen it can actually adversely affect your outcomes. Not that patients are going to be worse long term, but the experience, when we talked about the fact that pain is an experiential process and your brain processes it that way, if that experience is not perceived as a good experience, that infusion may reset whatever, but may also set in whatever that negative experience was, thus a net zero. So you want to get in, get out, have a positive experience. You want to reach a certain plasma level. There's a couple reasons why oral or nasal ketamine do not allow us to do that. Number one, when you're taking it oral or nasally, you're seeing a peak plasma level. You're seeing a big spike and this big drop off. While in some cases that might be better than nothing, you're really not doing a ketamine infusion at that point. So you're not seeing the same benefits. But here's what happens when that becomes the norm and you do that every day, is you start seeing daily NMDA inhibition as well as the multiple other pathways that we had talked about. Well, we know very specifically that too much ketamine or constant antagonism of the NMDA receptor can actually lead to neural degeneration. What does that mean in English? That means you're going to be killing your nerves off. You're going to be causing problems because the NMDA receptor, all these receptors are there for a reason. Okay, and that one is actually very intimately involved in gene expression and proper neuroplasticity and proper nerve function. So the lack of it is going to decrease proper gene expression and proper nerve function and health. So that's why. So there's multiple reasons. One, you're not really getting the benefits of what you do with infusion. And two, you may be actually causing what you don't want to do, which is more nerve degeneration.
Thank you.